Nursing theories or models. These are the three models that we choose. First is Heldegard Peplau. She developed interpersonal relations model. And second is Joyce Travelbee. She developed human-to-human relationship model. And the last is Josephine Paterson and Loretta Zderad. They developed the humanistic nursing theory. Heldegard Peplau was known as a psychiatric nurse of the century. Heldegard Peplau, she developed the interpersonal relation models. She was born in 1909 and died in 1999. And she was also known as a mother of psychiatric nursing. She was born in 1909 in Reading, Pennsylvania. In 1931, she graduated from Boston, Pennsylvania School of Nursing. Peplau earned a bachelor's degree in interpersonal psychology in 1943 at Bennington College in Vermont. Peplau held master and doctoral degrees from Teachers College, Columbia University in 1947. In 1952, Heldegard Peplau published her theory of interpersonal relations, and she was a doctor of education in curriculum development. And also she was the professor of emeritus from Rutgers University, United States. Then she started post-baccalaureate program in nursing. She became the first published theorist since Florence Nightingale, and she worked at the Lakeview and Chestnut Lodge Psychiatric Facility. In 1999, she died at Sherman Oaks, Los Angeles, California, United States at her sleep.
Will be interpersonal theory of nursing. A nurse does not only seek to alleviate physical pain or render physical care. She ministers to the whole person. The existence of the suffering, whether physical, mental, or spiritual, is the proper concern of the nurse. So Joyce Travelbee is a psychiatric nurse, educator, and a writer. At 1956, she completed her Bachelor of Science in Nursing degree at Louisiana State University. At 1959, she completed her Master's of Science degree in Nursing at Yale University. At the year 1952, a psychiatric nursing instructor at DePaul Hospital Affiliate School, New Orleans. Later in that year, in Charity Hospital School of Nursing in Louisiana State University, New York University, and the University of the Mississippi. At 1963, she started to publish articles and journals in nursing. And at the year of 1966 and 1971, she published her first book entitled Interpersonal Aspect of Nursing.
The humanistic nursing theory was created by Dr. Josephine Paterson and Dr. Loretta Zderad. Paterson was a public health major with a doctorate in nursing science, while Zderad was a psychiatric nursing major with a doctorate in philosophy. The two met in the 1950s at Catholic University for a graduate program. They were tasked to create a new program that would combine psychiatric and community health elements. This program would eventually evolve into what is now known as the theory of humanistic nursing or the humanistic nursing theory. Dr. Paterson mastered in public health nursing, completed doctorate of nursing science degree at Boston University with dissertation on comfort, while Dr. Zderad mastered in psychiatry, doctorate at Georgetown University, and philosophy with dissertation on empathy.
Heldegard Peplau theories defined nursing as an interpersonal process of therapeutic interactions between an individual who is sick or in need of health services and a nurse especially educated to recognize response to the need for help. It is a maturing force and an educative instrument involving an interaction between two or more individuals with Heldegard Peplau interpersonal relations theory. Assumptions are: nurse and patient can interact. Number 2, Peplau emphasized that both the patient and nurse matured as the result for the therapeutic interaction. Number 3 is communication and interviewing skills remain fundamental nursing tools. And lastly, Peplau believed that nurses must clearly understand themselves to promote their client growth and avoid limiting their choices to those that
Travelbee believed nursing is accomplished through human-to-human relationship that began with the original encounter and then progressed through stages of emerging identities, developing feelings of empathy and later feelings of sympathy. Travelbee's ideas have greatly influenced the hospice movement in the West. The nurse and the patient attain a rapport in the final stage for meeting the goals of nursing. It is a prerequisite to achieving a genuine human-to-human relationship. This relationship can only be established by an interaction process, and it has 5 phases. First is the inaugural meeting or original encounter. Second is visibility of personal identities and emerging identities. Third is empathy. Fourth, sympathy. And lastly is establishing mutual understanding and contact rapport, nurse-patient interaction. Original encounter, nurse first impression of the ill person and vice versa. Emerging identities, the beginning of the relationship between the nurse and the individual in which they perceive each other as unique. Empathy, the ability to share in person's experience and sympathy when the nurse wants to lessen the cause of the individual's suffering. While rapport is a process, a happening, an experience or a series of experience undergone simultaneously by the nurse and the recipient of her care.
Major concepts of interpersonal relations theory. The theory explains nursing's purpose to help others identify their felt difficulties, and the nurses should apply principles of human relations to the problems that arise at all levels of experience. The first one is man. Peplau defines man as an organism that strives in its own way to reduce tension generated by needs. The client is an individual with a felt need. And then the next is health. Health is defined as a word symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. And then the next is society or environment. Although Peplau does not directly address society or environment, she does encourage the nurse to consider the patient culture and mores when the patient adjusts to the hospital routine. And then the last is therapeutic nurse-client relationship. A professional and planned relationship between client and nurse focuses in the client needs, feelings, problems, and ideas. It involves interaction between 2 or more individuals with a common goal. The attainment of this goal or any goal is to achieve through a series of steps following of sequential pattern. 4 phases of therapeutic nurse-patient relationship. Number 1 is orientation phase. The nurse's orientation phase involves engaging the client and treatment, providing explanation and information, and answering questions. Number 2 is identification phase. Identification phase begins with the client works independently with the nurse, expresses feelings, and begins with to feel stronger. And then number 3 is exploitation phase. The exploitation phase, the client makes full use of services offered. And then number 4, the resolution phase. The resolution phase is the client is no longer needs professional services and gives up independently behavior. The relationship ends.
Humanistic nursing theory is multidimensional and it is an interactive theory. In humanistic nursing theory, the components identified as humans or the patient can refer to the person, family, community, and the nurse. The basic concepts and its definitions. Nurse-patient interaction. Contact between a nurse and an ill person, and both individuals perceive each other in a stereotyped manner. Interaction. Contact during which two individuals have reciprocal influence on each other and communicate verbally or non-verbally. Therapeutic use of self. Ability to use one's personality consciously and in full awareness in an attempt to establish relatedness and to structure nursing intervention. It requires self-understanding, self-insight, understanding of the dynamics of human behavior.
Suffering, an experience that varies in intensity, duration, and depth. A feeling of unease ranging from mild transient mental, physical, or mental discomfort to extreme pain and extreme torture. Meaning is a reason as oneself attributes, while nursing is to help man to find meaning in the experience of illness and suffering, as a responsibility to help individuals and their families to find meaning, while the nurse, spiritual and ethical choices and perceptions of illness and suffering is crucial in helping to find meaning. Hope. Nurse's job is to help the patient to maintain hope and avoid hopelessness. Hope is a faith that can add real change that would bring something better with it. Hope's core lies in a fundamental trust in the outside world and a belief that others will help someone when you need. Communications, a strict necessity for good care nursing, and one is able to use it self-therapeutic. Using self-therapeutically is a self-awareness and understanding of human behavior. The ability to predict one's own and others' behavior are important in this process, while targeted intellectual approach is a nurses must have a systematic intellectual approach to their patient situation.
Development of the theory. Work of Sullivan's theory of interpersonal relations. The concepts from other disciplines. Work of Freud, Maslow, psychoanalytic model. Observation of existing nursing practice. Analysis of interaction of students with patients. Study of nurse-patient interaction through process recording. The experience in psychiatric field. Own concept, values, and beliefs about nursing. Travelbee's theories is based on her cumulative nursing experience and her readings rather than the evidence of a particular research study.
The role of nurse in the therapeutic relationship identified by Peplau. First is strangers. Stranger, offer the client at the same acceptance and courtesy that the nurse would respond to any stranger. And then the next is resource person. Resource person providing specific answers to questions within the larger context. And then the next is teacher. Teacher is helping the client to learn formally or informally. Then the next is leader. Leaders offer direction to the client or group. Then the next is surrogate. Surrogate serving as a substitute for another such as a parent or a sibling. Then the next is counselor. Counselor is promoting experiences leading to help for the client such as expression or feelings. And then the last is technical expert. Technical expert providing physical care for the patient in operating equipment.
It requires the use of principles and method to deal with everyday interpersonal problem or difficulties. Since illness provides opportunity for learning and growth, nursing can assist clients to develop competencies through nurse-client interaction. Nursing can take as its unique focus the reactions of clients to the circumstance of their illness or health problems. All human behavior is purposeful and goal-seeking in terms of feelings of satisfaction. The interaction of nurse and client is fruitful when the method of communication that identifies and uses common meanings is at work in the situation. Difficulties in interpersonal relations occur in varying intensities throughout the life of everyone. Patient is able to participate in an interpersonal relationship. Interpersonal relations will enhance self-maturity and or self-fulfillment.
Interaction. Interaction is a phenomenon that occurs between people. The outcome of interaction is positive or negative. Understanding, misunderstanding, openness, closeness, low fear and anxiety, phenomenological, preparation of the nurse knower for coming to know. Nurse knowing the other intuitively. Nurse knowing the other scientifically. Nurse complementarily synthesizing known others. Succession within the nurse from the many up to the paradoxical one. In the implementation of nursing, the philosophical perspectives of humanistic nursing theory are relevant to the practice of hospice and palliative care nursing. Research. Research is defined as the theory in which the research to explore how patients gain meaning after a recent diagnosis or illness. Applied in the theory of caring cancer patients, practice application of the theory clinical setting, which basically helps inform how nurses can build relationships, how we can set goals for nurses, and it has been influential in hospice care with helping patients find meaning in their imminent death. Academics. Travelbee's theory has influenced current nursing curriculum. She emphasized communication as a therapeutic tool. Due to this theory, the focus of nursing education is changing from the sign, symptoms, and intervention, which it changes to a more holistic and very, very, very formal care. In conclusion, the use of core concepts in the humanistic nursing theory can provide a unifying language for planning care and description of investigations. Future research efforts in hospice and palliative nursing should be defined and evaluate these concepts for efficacy in practice settings. In the theory of Peplau, she has proved that greatly used to later nurse theorists and clinicians in developing more sophisticated and therapeutic nursing interventions, including the 7 nursing roles, which show the dynamic character roles typical in clinical nursing. It entails that a nurse's duty is not just to care, but the profession also incorporates every activity that may affect the client's health. However, the idea of nurse-client cooperation is found narrow, with those individuals who are unfit and powerless in conversing, specifically those who are unconscious and paralyzed. So, in studying Peplau's interpersonal relations theory of nursing, it can be very substantial, especially to aspiring to be part of the profession, if you want to become a nurse. Knowing the 7 nursing roles, future nurses, like us in general, can apply for different roles in different situations, which will guarantee our patients' success or acquire the best care possible and ultimately speed along the treatment and recovery. So just for the future of us nurses and those persons out there who wants to be a nurse someday. Thank you.